Hi everyone, welcome to Low Back Care. This is a What's What meetup, about 15-20 minute talk regarding low back care. All right, so the question won't pop up, but the question is, how many adults will experience low back pain at some point in their lives? This totals out to 80%. So this is also in your handout, but 80% of adults will experience low back pain at some point during their lives. So that doesn't even break down with gender. It's across all genders and across all ages. Next, we have common causes of low back pain. The first one is sprains and strains. So this may come from causes such as poor lifting techniques, lifting an object that is too heavy, overstretching through the range of motion, or performing a task away from the body. Next, we have trauma, which includes sports injuries, accidents, or falls. Again, we have problems with intervertebral discs. So with that, we have discs that are in between our vertebrae of our back, and this acts as a cushion in our spine, but when ruptured and inflamed, that can cause a low back issue. Next is arthritis and other medical conditions. With this, we have scoliosis, fibromyalgia, and pregnancy as certain medical conditions that can affect our lower back. Other factors include compressed spinal nerve, skeletal issues, or infections to our spine. All right, here we have triggers for low back issues. The first being an inactive lifestyle, which is directly correlated with staying in a single position, like sitting or standing for too long, that may cause discomfort. Next is poor posture. So again, sitting or standing or even driving for too long in the same position. Next is overexertion in work or play. We'd like to give the example of the weekend warrior who is sore after being much more active than their body is used to. So if we live a sedentary lifestyle and then on the weekend we choose to overexert ourselves, we're going to be really sore and then in turn hurt our lower back. Next, we have poor body mechanics. So like we talked about in the sprains and strains, this could be poor lifting technique, bending, reaching outside the range of motion, carrying too heavy of objects, that sort of thing. Next, we have tobacco use, which interferes with nourishing the body, slowing healing through the body as well. And if you're coughing, it also may lead to back pain. Poor sleeping position. So we like to tie this in with your mattress, having good support, and just knowing when it's time to rotate the mattress as well, or to get a new one that's more supportive to your back. Next is stress. Stress has several effects on the body. However, it can directly correlate to our lower back because that is a soft spot for many injuries. But I like to rope this all together by saying that many times back problems come on over time due to lifestyle factors or even as a result of one bad movement. So it's great to understand this circle of what could be going on with your lower back. Maybe it's one, maybe it's two, but just to really take a look at what's going on with your lower back. Next, we have preventing low back problems. So even if you don't have low back problems, this is ways to prevent. First, we have when adding exercise, start slow and go slow. Try not to be a weekend warrior, as tempting as it may be to get more exercise. We want to start slow. So if it is going for a run on the weekend or even a walk to start, that is totally fine. Just make sure that you're listening to your body. Next, we have strengthen your core. So the core muscles are found in the trunk area of the body, and keeping them strong helps support the lower back. So that is on the opposite side of the body, so on the front side of the body, which can be super important when supporting the other side of the body, as well as the glutes. Next, stretch regularly. I am a culprit of not being able to stretch very often. I try to make excuses not to do it, but it's super important because it may reduce stiffness, increase range of motion, and reduce the risk for injury. So if we know it's been a problem of ours to integrate that stretching. Just do a little bit before your workout and a little bit after, and that'll be a great start. Next, we have be physically active regularly. So a sedentary lifestyle, like I had said, or staying in the same position for too long increases the risk of back problems, especially when we're used to sitting all the time. It may be hard to integrate something right away, but just to know that there's an option to just get up and walk around for a short break. Next, we have learn proper posture and body mechanics. So this can serve as an introduction to ergonomics and just really paying attention to your posture, whether it's work day, while you're watching TV, also other functional things like driving, or even sitting at the kitchen table. Next, we have listen to your body. Don't push through pain. If you feel pain during an activity, stop. Don't just push through it. Again, listen to your body and know what it needs. All right, we have managing discomfort. So we have two different areas, short-term and long-term. So how to manage the discomfort for acute, we can do anything between hot or cold packs, keep moving to ease stiffness, or we can use a pain reliever, but please use caution. Next, we have chronic, so we can still use regular physical activity, those hot or cold packs, but really enforce it with a healthy lifestyle. As it gets to be more chronic, you want to support it in other ways, like healthy eating, good nutrition, sleep, tobacco cessation, and relaxation techniques as well. Because our muscles are under tension if we're under stress, so just make sure you're using some relaxation techniques. All right, we've got our first stretch. So this is a hamstring stretch that'll work the back part of your legs. And again, do not overuse these techniques. Discontinue if you experience numbness, tingling, and or increased soreness. Just make sure you're working in your range of motion. If it starts to be painful, please stop and yeah, try it again some other time. Here we have the back bend, so just be careful that you're moving slowly out and slowly back in because we don't want to arch too fast and injure our lower back. Although this is a great stretch, especially if you've been sitting all day, especially working from home, or ergonomics may be compromised. Next one is quadricep stretch. So this is a great stretch that you can do while you're in a meeting or while you're watching TV. And you can just use the back of a chair to support yourself. You can also, if you feel the need to work on your balancing, you can also balance to do this as well. All right, so here's how to identify some red flags. Numbness or tingling in the legs or extremities. Severe pain is not improving. Pain caused by a fall or an injury. Pain only at night. Back pain with trouble urinating. Weakness, fever, or unexpected weight loss. These are some situations where it is important to seek care from a doctor, as they may be signs of something more serious that requires treatment. All right, what will you do next? Here are some possible next steps to keep your low back healthy. Ask about ergonomic assessment / job site work analysis. So again, we may already have ergonomics implemented in our workspace environment, but it's great to catch up and see if there's anything new that has come into the industry. Next, we have try a recommended stretch. So there we have 3 different stretches that we've given you, and those are great stretches to start. However, it's great to practice those more regularly. Break up a prolonged period of sitting or inactivity. So this could be even just walking to the other end of the house while we're working from home, or even when you're sitting at your office, walking to the other end of the office space. And lastly, add a few minutes of movement and aim to make it a daily habit. So this is a great start. Again, we don't want to surprise our body. We just want to slowly integrate some physical activity or exercise. And that can even be helped from our fitness professionals, group X instructors, or personal trainers, and just know that they're there to support you as well during this time and once we get back in the office as well. All right, that's all I have for you guys. Thank you for attending this meetup, and let us know your feedback. Have a great day.